The second half of the conference is going to be very interesting indeed. We've got three speakers who have been with us for the past 3 years: Dr. Joseph Jemsek, Dr. Sarah Michael, and Dr. Armin Schwarzbach. Tell us more.
Well, so the exciting part about the second half of the conference is that Dr. Joe Jemsek, Dr. Sarah Myhill, and Dr. Armin Schwarzbach are really experts in infectious disease, and infectious disease with neuroimmune neuropathogenesis. So Dr. Jemsek's expertise in the beginning was HIV/AIDS, and there was a dementia associated with HIV/AIDS infection that really had nothing to do with copy number. So the therapeutics, the antiretroviral therapies, didn't necessarily change the outcome of the neuropsychiatric, the dementia in those diseases. So Dr. Jemsek moved on to looking at borreliosis, which is also a neurotropic infection that has a lot of psychiatric manifestations and complications, and so his expertise at thinking about all of these, and now we've built in, and he's built in, so I'm really excited about his talk because he's talking about metabolic changes. He's talking about weight changes. We see in this patient population either unnaturally fat or what we used to call AIDS patient thin, cachexia, that they can't metabolize energy and food and translate it into energy. And so Dr. Sarah Myhill has spent, her career with Dr. John McLaren and Dr. Norman Booth thinking about the mitochondria. And of course, the mitochondria is the energy powerhouse. So when we think about how we're not translating energy in these infectious diseases into fueling the brain, which is fueled, in the fat level in the membrane, so critical, and thinking about the mitochondria. So the largest source of mitochondria are your muscles, your heart, and your brain. So your brain and your muscles are going to shut down before your heart shuts down, because that's the end of the road. So this is how we think about it. Very, very exciting to think about these two things together and have these experts here to round out what we hear in the morning session. Dr. Armin Schwarzbach, his expertise is in diagnosis of the infection. So it's not so much to diagnose the infection, but the co-infections so that we can understand the communication. So each of these pathogens disrupts and dysregulates the immune and the endocannabinoid system, our endogenous cannabinoid systems, and our purinergic signaling. That's the nucleotide signaling, our very DNA signaling in a different way. And when you think of overlapping pathologies, we think that microbes never travel alone. So we learned in HIV/AIDS that different infections would allow the pathogen to survive, allow the pathogen to take up residence in either the brain or the immune system and persist. And that's obviously the goal of every organism, is to persist and replicate and make more of them. So the whole idea of Dr. Schwarzbach's expertise at Armin Labs of detecting the co-infections, which inform the physicians like Dr. Myhill, Dr. Jemsek, how to treat. What's the best course of therapy, and what's the protocol, what's the order of therapy. And that's what we learned in HIV/AIDS in particular, is that if you didn't treat the biggest invader and the biggest problem to the survival of the host first, it really didn't matter about the underlying borreliosis or retroviral infection or aluminum toxicity. You have to really be careful because of the key elements of how they disrupt the immune system in the mitochondria. So I can't wait to hear and we'll follow up the entire meeting with a panel discussion with Professor Malcolm Hooper, myself, and the speakers from the conference, among others, to talk about bringing it all together. And so then the expertise of almost 40 years of looking at these diseases, now bringing it to look at neurological, neurodegenerative, neuroimmune, traditionally psychiatric diseases or psychosomatic diseases as infection, as a bad immune response or a bad endocannabinoid response. So how we can then really affect change and the opportunity to really have curative protocols for these diseases, recognizing the underlying crosstalk and overlap in pathways is the excitement of this year's meeting at the Academy of Nutritional Medicine. And I really do think it's going to be really a paradigm shifting meeting. We'll talk about the last 3 years and how the Academy has set up the various speakers and brought us to the point where I think we can all pull it together in a way that really affects benefit for entire patient populations.